Assalamualaikum and very good evening to the participants, and also very thank you to the organizer, yeah, for this opportunity, to accept my paper to be presented in this conference, International Conference of Economic, Business, Islamic and Technologies 2020. Without further ado, let me present my paper, which is with title Perceived Service Quality, Customer Satisfactions, and Behavioral Intentions toward Hospital in Sabah. This research actually granted by UMS, by University Malaysia of Sabah, which is under Center of Research and Innovations. Okay, let me start with my presentations. Okay. As an introduction, this study aims to examine the rules of perceived service quality towards behavioral intentions is mediated by the effect of customer satisfactions among hospitals in Sabah. So actually, as we know that Malaysian healthcare system in advance due to extensive support from Malaysian government through investment in hospital medical infrastructure. This is actually from Pemadu 2020. The improvement in the last 10 years are significant enough to be at par with well-developed countries, comprising of both, which is well-trained medical staff and excellent hospital facilities, which is intangible and also tangible items in hospitals. Public healthcare is the cheaper options. However, private hospitals have their advantage over public ones. Due to the public healthcare more cheaper, that's why sometimes we can see in the public hospital always congested with patients, but compared to the private hospital. So for those patients or customer prefer quality or sometimes harmony situation, they will choose private hospital rather than public hospital. But if those are actually looking towards good treatment and also in terms of convenience, our experts from the doctors, they will prefer from the public healthcare or public hospital. So this is actually what I want to see in this study. What is actually things that we need to consider as a public healthcare or private hospital in due to fulfill the customer's needs and wants once they are actually try to use the service provider from this healthcare industry. Okay, for this study, we are using three-component attitude model as the theory for this research, which is this study will test. This study tested the link between perceived service quality, customer satisfaction, and behavioral intentions. Will explain using this model. So commonly, this theory uses customer marketing research to examine the attitude of consumers towards certain subject or objects. So in this model, there are three components, which is as a construct for this model, which is first cognitive component, which is more towards thinking and knowledge. And second, affective component, which is more towards feelings. And the last one, which is cognitive component, which is more towards behavior. This is actually based on SL 2004, Shipman and Kanuk 2004, and Solomon 2002. Okay. From the previous study, we actually will focus on these three, which is behavioral intentions, perceived service quality, customer satisfaction. So in this first part for the literature, I'll focus on the indicator of behavioral intentions. From the various study, which is first from the Laddery, Zitman, Karuna, Lewis, Newman, yeah, and Antosophilus, they are actually looking towards this type of study, which is on the behavioral intentions indicator, which is they use these favorable and unfavorable indicators, which is first through the endorsement of word of mouth, second, willingness to pay a high price and spend more, third is loyalty. For unfavorable, it is actually in the negative side. So from this study, it is actually shown that significant relationship between favorable and unfavorable signals towards behavioral intentions. Okay, second, from the Host, yeah, and Kenny, which is 2004, and Alnett 1968, they actually use recommendation as an indicator for behavioral intentions, which is more on person-to-person interactions, willingness of a non-commercial communicator, and the third one, which is financial profit. So in here, the findings from the study, the recommendation, which recommendation construct significant to behavioral intentions. Okay, last on the Zitman, Kessler, Oliver, Bay, and Chow, they actually use loyalty, behavior, and engagement as the variables, which is towards behavioral intentions. So in here, loyalty and engagement significant to behavioral intentions. Okay, next, which is on perceived service quality. Yeah. So in here, I want to show how this perceived service quality actually can be used in healthcare industry. Yeah, from previous study. Yeah, Bronos, yeah, Cronin and Taylor, yeah, Balding, Parasuraman, and Zilman and Berry. They are actually define perceived service quality as a consumer's judgment, impressions, and evaluation process in which the consumers compare service expectations with service perception with regards to the overall excellence of the service provider. This one actually applied to all industries. Second, which is from Babakus and Bowler and Gronos. Yeah, this one actually applied for healthcare industry. So this study actually used the opinion of patient or consumer, which reflect by the service provided by the service provider that are most appropriate in yielding the best result reasonably expected by the patient or consumers. So this is actually more towards healthcare industry. Yeah. So in this study, we use these definitions, which is by Babakos and Bolle, and also Granus. Yeah. Okay. Now we move to customer satisfaction. This study actually used overall satisfaction as a functions to better understand consumers in the context of healthcare services, which is it has been affirmed that to be more applicable to operations of consumer responses. So there are two studies, yeah, which is define customer satisfaction, which is first from Oliver. Oliver definitions more related to all industries, but Russ and Oliver, which is 1994, mainly used for healthcare industry, which is in here, customer satisfaction or CS defined as a summary of either transaction to a specific level or overall level in the cognitive and effective reactions regarding a service encounter. So this is the definitions under healthcare industry for customer satisfactions. Okay, from the previous study, yeah, there are relationship between behavior intention, perceived service quality, and also customer satisfactions. First, which is by Bittner and Hubbard, Moha and Bittner, Oliver and Parasuraman. In here, the findings shown that customer satisfaction is seen as antecedents with a given service experience, influence perceived service quality, where satisfactions will affect the outcomes of the perceived service quality over time. So the relationship shown that our outcome of perceived service quality, which is service experience, protected by customer satisfactions. Second, Dolba, Brandy, Coronin et al., and Gottby, they actually shown there are different views, which is customer satisfaction as an emotive satisfaction construct as a resultant of service quality, which is from the cognitive evaluation. So in this study, customer satisfactions influence perceived service quality directly. Okay, third study, which is by Dub Halka and Overby 2005, quality of service comes before customer satisfaction for normal or non-extreme services. So in which the services provided are acceptable range that enable customer to rational and cognitively evaluate the services. So in here, perceived service quality influence customer satisfactions. Yeah. Okay, the last one, which is from Ali and Amin. Yeah. So in here, they actually give different view, which is a significant relationship between perceived service quality, customer satisfaction, and behavioral intentions was observed to be evident, which is in here, perceived service quality and customer service quality with behavioral intentions have direct and also sometimes indirect relationship. So this is actually from Ali and Amin 2014. Yeah. So this is my the literature used in this study. The methodology used, which is questionnaire, examining the relationship between perceived service quality as an independent variables, overall customer satisfaction as a mediator, and behavioral intention as dependent variable, as a dependent variable. Okay, in this study, self-administrative survey, which is used convenience sampling method, the respondents are from the age of 18 and above, which is those visited a hospital of at least once from the previous health-related matter. So yeah, there are actually filtering questions. The filtering questions, which is to make sure the respondent are 18 years and above, and those are actually visited a hospital at least once. Yeah, so as a patient, yeah, or as a user to the hospital services. Okay, from this survey, there are actually 5 sections. Section A on demography, B on the respondent pattern, which is those are visiting hospital, perceived service quality, and in the sections C, section D more on customer satisfaction, and the last one behavioral intention. So this survey questionnaire use 7-point Likert scale, bilingual language, and the study analyzed using PLS SEM and also SPSS version 25. Okay, from this study, yeah, the minimum sample calculated by G power calculator, there are actually 107 minimum samples. Yeah, so overall from this study, yeah, in the data collections process, total 213 set of questionnaire returned from total overall 450 distributed questionnaire. So from these 213, only 208 set of questionnaire can be used, which is fulfill the data screening, which is those are actually 18 years and above, and also visited hospital at least once in the previous visit. Okay, so this is the hypothesis used. There are actually in general 4 hypotheses. Yeah, first, which is there are positive relationship between perceived service quality and behavioral intention. Second, there are positive relationship between perceived service quality and customer satisfaction. There are positive relationship between customer satisfactions and behavioral intention. And the last one, customer satisfaction mediate the relationship between perceived service quality and behavioral intention. Okay, this is the data from our research. Yeah, so this research actually consists to another three researcher. Yeah, so we use this data. Yeah, we managed to get 208 usable questionnaire. From this questionnaire, there are actually 88 respondent male and 120 female. Yeah, so this is the demography profile, yeah, of the respondent. So most of them are professional, which is 148, 43 uh, uh, means they are actually from the professional industry, which is involved with many types of industry. And also there are also non-professional 28, yeah, housewife 7, students 9, unemployed 1. Yeah, okay. So the incomes, yeah, so they are actually above 5,000. Yeah. So this is the demography. Yeah. So in terms of the status, very good, 58, good, 93, fair 26, and poor 1. Yeah. Okay, so this is the means the frequency of visit and also reason for visiting of hospital. Yeah. So from this study, we found that there are once or more a week, 6. Yeah. 2 to 3 times a month, 63. Yeah. At least once every few months, 118. Once a year, 21, and very seldom 5. Yeah. So most of visit, it is actually more towards on the purchase of the medical items. Yeah, medical products. Yeah, they are actually main user. Yeah, the review, doctor review only 36. Yeah, ask for doctor advice only 4. Yeah, and to purchase devices only 4. Yeah, and others is more on general health information, to buy first aid information. So this is the frequency of visiting and reasons for visit. Okay, now I move to descriptive analysis on the construct. Yeah, so the mean, which is more on more towards the agree. Yeah, more towards agree, which is also close to slightly agree. Yeah, so this is the construct. Yeah, and also the convergent validity. Yeah, this is the loading and also composite reliability, and also the AVE values. Yeah, for the construct. Yeah, for assurance, empathy, reliability, responsiveness, tangible is more on perceived service quality, yeah, and satisfaction, and behavioral intention. Okay, so this is the structural model, which is to test the structural modeling. So here the R square we get 0.709. Maybe this is technical studies, so that's why the R square is high. Yeah. Okay, from the test for direct relationship, yeah, between PSQ to CSQ and BI. So there are actually a different result for the PSQ to BI, yeah, PSQ to BI, which is behavioral intentions. There are actually 3, yeah, non-supported, which is under reliability, responsiveness, and assurance. Yeah, but for the tangible and also empathy, this is the means there are significant, yeah, relationship between PSQ to BI. Yeah. Okay, so the second hypothesis, which is from the PSQ to customer satisfactions. Yeah, accept reliability and responsiveness. Yeah, all are supported. Yeah, but reliability and responsiveness not supported. Yeah. Okay, for the H3, yeah, from the satisfactions, which is for direct, yeah, satisfactions to behavioral intention, it is actually supported. Means satisfaction has direct relationship with behavioral intention. Okay, the last hypothesis on hypothesis 4, which is from to test the mediations. Yeah, what is the relationship? Yeah, what is the contributions of mediations, which is satisfactions towards relationship between PSQ to BI. Yeah, from these PSQ to BI, there are only two. Yeah, which is shown that actually not mediate. Yeah, the relationship, which is reliability and responsiveness. Okay, so from this study, most of respondents actually had only visited hospital once every few months, and the outcome of this study actually parallel with the study done by Chia, which is conducted study in Sabah also. Yeah, so most of participants frequently visited hospital purposely meant for this, which is to buy that medications purpose, yeah, medications items, yeah. So from the result, it's shown that tangible and empathy are positive predicted to behavioral intention. Assurance, reliability, responsiveness, which is not really support the behavioral intention in this study, yeah, in this study. So from that five indicator, which is under PSQ, empathy pose more impact on customer satisfactions. Yeah. So and also here, tangible assurance and empathy discovered to have positive relationship on customer satisfactions. Reliability and responsiveness not really demonstrate significant relationship with customer satisfaction. So this study actually consistent with Saka and Udins and Burhan 2017. Okay, for the customer satisfaction, it's shown that it is actually significant to behavioral intentions. Yeah, so from previous study also supported. Okay, now in terms of the mediations, the role of customer satisfactions as a mediator to tangible assurance and empathy actually mediate the relationship, which is the customer satisfaction mediate the relationship with behavioral intention. Yeah, and in terms of reliability and responsiveness to behavioral intentions, customer satisfaction is not really mediate the relationship. So this is actually consistent with the result from Osman and Santosa 2013 studies. Yeah. Okay, let me actually go for the conclusions. Yeah, means from this study and also from the evidence. Yeah, it shows that for the hospital in Sabah, they need to actually look towards these situations, which is they need to establish benchmark for construct being considered, yeah, and continuously monitor, yeah, towards performance through customer feedback. Yeah, so this study, which is to these Sabah hospitals, yeah, found that the means the hospital need to develop and implement a strategy. Yeah, at least this public and private hospital can gain good satisfaction and also good view in terms of the services provided. Yeah, maybe the focus is more towards the public hospital. Yeah. Okay, so customer satisfactions was linked to enhanced behavioral intention, and behavioral intention are driven by their satisfactions with the experience in relations to service quality, expect, which is tangible, assurance, and empathy particularly. Okay, and finally, the since assurance and empathy are since as a stronger driven force to behavioral intention. Therefore, marketing strategies and effort for promoting service quality should be established. Yeah, from these two, which is assurance and empathy, by focusing on improving customer satisfactions, which is to make sure it contribute to improve behavioral intentions among hospital, either public or private hospital in Sabah. Yeah, but in this study actually there are limitations also. Yeah, because this study actually not differentiate between public and private hospital, but the other article the other article, which is will be published in maybe in next month, it is actually show the relationship or the comparisons between public and private hospital, particularly. Yeah. So without any, thank you very much. So I want to end my presentation and thank you very much.